The Facts of Medicine, presented by the Harvard Medical School and the Lowell Institute, with Dr. David D. Rutstein, Professor of Preventive Medicine, Harvard University, and Mr. Parker Wheatley, General Manager of WGBH-TV. The Facts of Medicine is made possible by a grant in aid from the John Hancock Mutual Life Insurance Company and produced in the studios of WGBH-TV, Boston. The Facts of Medicine, presented by the Harvard Medical School and the Lowell Institute, with Dr. David D. Rutstein, Professor of Preventive Medicine, Harvard University, and Mr. Parker Wheatley, General Manager of WGBH-TV. The Facts of Medicine is made possible by a grant in aid from the John Hancock Mutual Life Insurance Company and produced in the studios of WGBH-TV, Boston.
Dr. Rutstein, when you talk about cancer, I'm sure that what every one of us wants to have answered is, are we making any progress in this country in the fight against cancer?
Well, Mr. Wheatley, I'm glad to say that we are making progress in this fight against cancer. And in order to make this progress a bit more clear than it might be, and in order also to allay your fears, you know cancer is a disease that raises much fear in the minds of people. And I hope that after tonight's program, you will agree that although this is a serious disease, of course, that the picture that's usually painted about this disease is much more serious than what the facts really are. Now, for example, Mr. Wheatley, here, we have the major causes of death, 1953, in the United States. And we see that there are 4 major causes of death, with heart disease first, cancer second, strokes third, and accidents fourth. Now, there are about 570,000 people that die in the United States every year of heart disease, and about 230,000 dying of cancer. Now, of course, that still makes cancer a serious disease. That's about 1 out of every 700 people in the United States die of cancer every year. But it doesn't compare with heart disease at all. Heart disease with more than twice as many. And most of that 570,000 is due to diseases of the coronary arteries, circulation of the heart. That's actually, there are 373,000. Remember now, cancer 230,000, and yet coronary heart disease alone 373,000, about 1.5 times as many anyway. And yet, the fear about cancer is about as unreasonable as some of the optimism about coronary disease. Neither of these things is very reasonable. And yet, both are serious diseases. But cancer hasn't nearly the potentiality of coronary disease, particularly when you realize that in many cases you can take the cancer out completely with surgery. Whereas in coronary disease, after the attack, the individual is still left with a damaged heart. So that I wish some of the optimism on coronary disease tonight will be spread over to cancer.
This is encouraging, Dr. Rutstein, and I think I'd like to know, I hope others would like to know too, just what is this thing, cancer?
Well, this disease is a complicated one, but perhaps before we get into that question, maybe what we ought to do is to really encourage our audience and show them what's been happening since 1940 in cancer in the United States. Now, fortunately, through Dr. Harold Dorn of the United States Public Health Service, I can show you some unpublished material on what's been happening in this country on cancer from 1940 to 1950. It'll shortly be available in the medical journals, but Dr. Dorn was kind enough to let me show you some of this tonight. Now, look what's happened in this 10-year period. Here we have 1940 to 50 males, and all cancers have increased in death rate 6%. Now, you'll say that isn't very encouraging. That's not much progress, is it? Increasing 6% in death rate. But let's look down lower and see why it's increased 6%. It's increased because lung cancer alone has increased 103% during that same period.
Lung cancer.
Lung cancer. If we took lung cancer out, we would have actually a decrease of death rate of 2% in the whole country from all cancers.
Among men?
Among men. Among white men. Now, in females, among females, there's a decrease of 8%. You see lung cancer much less common among females, only 23% increase, but still an increase, you say. But you see it will be 9% decrease, which is quite a bit, in a decade, in deaths among women with cancer. Now, we'll talk much more about lung cancer, some in this program and in later programs. But I think it's important to remember that this is the one big reason during 1940 and 50 why the death rate increased in the United States among men. And finally, in terms of progress, we're making a lot of progress in basic research. We're building up our investment capital. That is, these decreases that you just saw in the death rates are the profits, so to speak. But before you can have profits, you've got to invest something. And investment here means lots of research on basic problems. And material and information is collecting at really a rapid rate. And this investment capital is going to pay off, I'm sure, in a great many ways.
Now is it time, Dr. Rutstein, and I do appreciate your stopping me on that question of what is cancer. Is it time for you to answer this for us?
Yes, I think we'll say something about that. Cancer simply results from lack of control of the growth of cells in our bodies. You know we're made up of cells, and when we cut our fingers or our hands, cells grow to repair that defect. And, but when cells grow in cancer, there is no control. Now, thanks to UPA and the American Cancer Society, I'd like to show you a film in which you will be able to see how cells look, diagrams of cells, and you see how they're growing. They grow and they push the other cells out of the way, and they get bigger and bigger. Now, if it stays there, it's a benign tumor if it's walled off, but if it starts to spread, the way you see it's doing there on the left of your screen, and starts going through the other part of the body, then it becomes invasive, and then we call it cancer. And here it's going into the lymph stream, and there into the blood. And you see then that cancer means that you have uncontrolled growth of cells, pushing other cells out of the way. We don't know what releases this growth. We don't know what controls this growth. And if it stays in the same place and becomes walled off, then that's usually a benign tumor, a tumor which can be removed completely surgically and leaves no permanent result. But if it breaks through and does as we saw in that photograph there, and invades into the tissues and may go into the tubes, the lymph or the blood tubes in our body, that take this all over the body, then we get spread of this disease. Now let's compare this. First, let's show how just a normal cell divides. We actually are fortunate to have an actual photograph in the microscope, thanks to Dr. W.H. Lewis of Philadelphia, who took these pictures. And you can see here this cell in the middle of your field, and you watch that now as that cell will gradually break into two parts. And this kind of growth occurs, of course, normally. And it also, you see it dividing now. See how it's dividing? It breaks into two parts. That occurs normally. But if that growth goes wild, then it's what we call cancer.
Grows wild?
That is, if it grows and keeps growing without any control. And when you say grows wild, perhaps the best thing I can do is show you what happens under normal circumstances. That is, what happens when a cell doesn't grow wild? What happens when we get a little cut or a damage or a tear or some cells die in our body and others go to fill in? And thanks again to UPA and the American Cancer Society, we have a film that shows how cells become damaged or disappear and then how they're filled in and how the growth stops there. And if we look at this film here, Mr. Wheatley, you can see that there are normal cells. And as we watch these normal cells, we'll see them some of them disappear. They've been destroyed. Now they start filling back in, you say. But then they stop. And that's the end of it, you see. It doesn't go any further. And that's normal growth. Now, do you think you have a pretty good idea then what cancer is in terms of this uncontrolled growth of cells in our body?
Yes, I do. Thank you.
Now, the other thing about it, I think, which is important, is that cancer is not one disease, it's many diseases. Many diseases depending on the organ of the body which is involved and the cell in the body which is growing wild. And therefore, we have no one rule about cancer. People will say, can we cure cancer? This is not a proper question. The question is, can you cure a certain kind of cancer? One of these very, very many kinds which there are. And a little later in the program, we'll we'll discuss some of these separate kinds. But the point I would like to make is that they are separate and different, and you cannot compare the results in one cancer with the results in another cancer.
Just who gets cancer, Dr. Rutstein?
Well, this is, I think, a very important question for our audience so they can have some understanding of how this disease spreads around. Now, I've got a chart here, again for 1953, again for the United States, and you can see that there is this chart here, and these are males here and females there. This is the white race. These are whites. These are so-called non-whites, mostly Negroes, but also including some Chinese. And you see that there are more cancers among the white race than among the Negro race, and that is the non-whites, and more cancer among males than among females. I think this is a little bit unusual because I think most people sort of think that cancer is mainly a disease of females, but really not. The point is here that this lower death rate from cancer among Negroes, among non-whites, is probably due to inadequate diagnosis and probably inadequate medical care. I don't really, except for skin cancer, where there is a major difference, I don't think that the disease is much different in the two races. Now, about the sex question and age, we have another little one here, little chart here. And here you can see that the older we are, the more likely we are to get cancer, and that males have it, as we said a moment ago, more than females. Actually, down in here, you can't see it very well. These are deaths. Actual cancer cases go a little higher in the female here than in the male, somewhere between 20 and about 45. Those are cases, because these are deaths, you say, we're talking about here. And you see that as males get older, they tend to get more cancer, and a good deal of that now is lung cancer.
About which you'll tell us more
That's
anon.
right. That's right. So, we see then that there are differences by age and sex and by races in this country. And of course, there are differences in the sites on our body, where the places in our body where cancer occurs. There are approximately 1 million cases of cancer probably in the United States all the time, compared with the 230,000 deaths, which we mentioned a little while ago. There are about 1 million cases of cancer in the process of treatment somewhere along the way in our country. And that's about the way the thing sizes up at the moment. But remember, this is a different disease in different ages, in different sexes, and also a different disease depending on the organ where the disease occurs. This is very important to remember, that there are many cancers.
Do you want to give us a list of these, Dr. Rutstein?
Yes. I'd like to say that we don't know the cause of cancer, but I can say that there are many factors that we know that lead to certain kinds of cancers, even though we don't know the causes of them. And if we do away with some of these factors, we can decrease the amount of cancer in some instances, and other instances the number of deaths from cancer. Now, one of them, for example, is skin cancer. This is the most common kind of cancer. And this is what's happened to skin cancer from 1940 to 1950 in the United States. You see it's dropped 32% in the males and 22% in the females, which is very encouraging. Deaths from skin cancer from the year 1940 to the year 1950. That much of a decrease. Now, what kind of a disease is this? Well, this is a very common disease. Most of the cancer is quite mild. It's easy to recognize because it's right on the surface of the skin where you can find it. It often follows two kinds of lesions. You know, when people get old, they get these little spots on their skin, sort of brownish or grayish spots in their skin. We call those by a big name. We call them senile keratoses. But actually, if you recognize them, and if one of them sort of gets a little sore and doesn't heal, then you should go see your doctor. It may be an early cancer, which in most cases is completely curable.
But all brown spots are not cancer.
No. These special ones that come on in old age that we call senile keratoses. And the one we're concerned about are the ones that get sore and don't heal. Also, we're concerned about moles on the body, particularly the grayish-blue ones, the bluish-black ones, that don't have any hair in them. And if they're a place where they're being irritated, they really ought to be removed beforehand. And if they seem to increase in size, they should be taken to a doctor immediately. This is relatively rare, but at least I think it's worth our audience knowing about this. As I said, this disease is much more common among whites than Negroes because the radiation of the skin seems to have something to do with it. That is, people that live outdoors, sailors, farmers, and so on, they're exposed to the sun, have much more skin cancer than people who do not live outdoors. And actually, in southern United States, there's about 4 times as much skin cancer as there is in northern United States, and males have about 1.5 times more than females do with this disease. But remember, it's easily recognized, and you see, as I've shown you in the chart a moment ago, how much improvement there's been in death rate simply because the disease now is being recognized. Another disease in which we have great progress is cancer of the skin or mouth. The lip or the mouth, particularly. That is, irritation from the corner of a lip, from a pipe, or from a jagged tooth seems to predispose to the occurrence of cancer in the lip. Sometimes people who have syphilis, which now is becoming a much rarer disease, tend to have more cancer of the mouth than people who don't have this disease. If anyone ever has any white patches in his mouth, those are the warning signs. That isn't cancer, but it's the warning sign of what we call a precancerous lesion. That is a disease that occurs before cancer occurs. So if you have white spots in your mouth, and I don't mean ordinary canker sores either, I mean persistent in your mouth, white spots which aren't painful, which you don't feel, I think you ought to show them to your doctor. Now, this disease is easily recognized also on the lip. It has a good prognosis, and again, we've made marvelous advances in the period of 1940 to 50 by cutting down the lip cancer death rate 50% and the female lip cancer death rate by 62%. It's more than half, you see.
By prognosis, you mean if we catch it in time, we
get
can
it
do something
early.
about it?
You can see we can do something about it. You
Yes.
can see the improvement that's occurred.
Even better than in skin cancer.
Even better than in skin cancer. It's the best so far, actually.
Mm-hmm.
Now, another important disease from the point of view of prevention is cancer of the mouth of the womb. This is a very serious disease if neglected, but is a disease that occurs in women, particularly in women who are married before the age of 20 and who have babies early. More common among women who have many babies than it is among women who have no children or who are not married. So this is a disease to be looked for among women who have been pregnant many times or early, and proper care at the end of a pregnancy of lacerations of the mouth of the womb will often help prevent this disease. But even if the disease begins, and the first sign usually is bleeding not related to periods. This is very important, particularly bleeding that comes on after the menopause. This is a warning sign, and it's not a serious warning sign because, as you'll see here, this is a disease also that has responded very well to treatment, so that in this 10-year period, the cancer of the womb death rate in the United States from 1940 to 50 dropped 26%.
You said not a serious warning sign, Dr. Rutstein.
The warning sign is a serious, but it shouldn't frighten the individual, is what I meant. And the fact that it points to a disease about which much can be done.
And has been done.
And has been done, that's right.
Incidentally, is the trend continuing, do you believe?
Yes, I do. I think the trend is definitely continuing, insofar as I can tell.
Because we're already 5 years or so
yes,
beyond.
but you see, it takes 5 years to get these figures together, and Dr. Dorn still hasn't published them. Now about cancer of the intestines. When we get the cancer on the inside of our body, it's harder, because unlike skin cancer, or some of the cancers that cause bleeding outwardly, and easily seen, cancer of the intestines has not decreased as much, only -1% and -5%. And this is a matter, we think, of people recognizing the possible early signs. Now, in the first place, this disease, among all the diseases, probably runs in families to a certain
Cancer of the
extent.
intestines?
That's right, to a certain extent, and probably only because certain families seem to have in their intestines things that are called polyps, little growths which aren't cancer in themselves, but which are a familial trait, and some of those tend to become cancerous. But they usually give warning signals in the way of bleeding from the bowel, and they also give warning signals by the fact that if something is going on, you may get changes in bowel habits, that is, onset of diarrhea or onset of constipation, something of this sort. But the major thing is that if you do come from a family where cancer of particularly of the lower intestine has occurred, then it is important for you to be checked up at various times if there's any sign at all of bleeding. And if there are any change in bowel habits, or if you pass stools that become tarry with blood, either very black with blood or very, very black like tar and sticky. It's a very particular kind of thing. It just doesn't mean just a dark stool. It means a black tarry stool. But this is important disease to do something about, because if it is recognized and if surgery is carried out, the disease tends not to recur.
Now,
this is important. You can do something about it.
Yes. Now, may I be sure that you say that cancer of the intestines is the only one, at least so far, of the different kinds of cancer which tends to run in families?
Well, we have lots of hints about it in other diseases, but this is one group where I think it's clearer than in others. And practically only if people have what we call polyposis, or these polyps in the colon. Otherwise, it doesn't run in families. It's really the polyposis that runs in families and not the cancer itself.
I'm glad you cleared that for me.
Now, breast cancer is a very common tumor among women. I guess it's the most common tumor that occurs, the most common malignant tumor that occurs. And we haven't made too much progress with this. Cancer of the male breast is relatively uncommon, and there hasn't been any change in it. Cancer of the female breast has been cut down 4% in 10 years, which is little enough. But there is one thing to remember about this, about cancer of the female breast, and that is every lump in the breast isn't cancer. If you get a lump in the breast, you should go see your doctor. More than half of the tumors of the breast that cause lumps are benign, as I described, the ones that are walled off. But it is important that you go, because it is good to have these things removed early, and I think it is very important for you to remember that a lump in the breast does not necessarily mean cancer. This is the important point. And that surgery is the recommended treatment for benign tumors of the breast as well as tumors which are cancerous. So surgery is the thing to do in this disease, and I think more can be done about it. Now, I've mentioned the lung and the bronchus. That is the cancer of the lung and the tubes going down in the lungs. And I can't say much more about that tonight because that's a long story. And there will be, in later programs, much discussion about this, particularly in its relationship to cigarette smoking. But I do want to call attention to one variety of cancer, one which we sometimes call cancer of the blood, leukemia. And you see what's happened between 1940 and 50. It's increased 46% in males and 39% in females. And this is a serious question. This is one of the tumors next to the lung cancer which is increasing. And we don't know why. Some of this may be improved diagnosis. But actually, some of it may also be due to the question of radiation. As you know, a lot more radiation is now being used than before in X-rays, and we're exposed to more radiation from the explosion of atomic bombs. We know the people at Hiroshima had, after the attack, later had more leukemia than you'd expect. We know that X-ray doctors have more leukemia. We don't know the reason for this. I am not saying that radiation has caused this increase, but I do say that we must watch this very closely now to see whether or not this amount of leukemia continues to increase. Now, even if cancer occurs, in the treatment of this disease, we have surgery, and we have radiation in the form of X-ray or radium, now some of the isotopes. We have all of these things, and they're very often extremely helpful. For example, in a cancer of the womb I told you about, radiation does a beautiful job and cleans it up in most of the cases that are caught early. Surgery does very well for diseases like cancer of the skin or cancer of the large intestine and so on. These are important methods of treatment. We are trying to find some miracle drugs. We call them chemotherapeutic agents, but miracle drugs that would hit cancer. And many of them are being tested. But thus far, although we have some that will stop the cancer from growing, we don't have any one drug that will stop it completely. So we have hopes in this direction, but we have nothing very positive at the moment. Now, the things for you to watch for, to make sure that you will be able to recognize this disease in its early stages, the so-called warning signals. Are very clear-cut. And The first of these is a lump. I've talked to you about that in terms of a breast. But a lump appearing anywhere for the first time. Many of them will be benign, many of them will be cysts, many of them won't be cancer at all. But a lump means go to your doctor. This is the first of the warning signals. Now the second is a sore that does not heal. A sore that does not heal. It's important in terms of the skin, but anywhere on the lips, anywhere that a sore occurs that does not heal. The third of these is a mole or a wart, particularly if it starts to grow or become irritated or bleed. But a mole or a wart, particularly the grayish-blue kind. Then we have the question of cough or hoarseness. Cough or hoarseness, which is persistent, stays on, comes on suddenly, you haven't had a cough and stays on, hoarseness that stays on. This is a warning signal. Difficulty in swallowing. By this I mean swallowing food that goes down and then comes right back up again. Really immediate inability to swallow, which is another warning signal to go to your doctor. And change in bowel habits I have told you about. Any change in bowel habits, the beginning of constipation suddenly, the beginning of diarrhea, changing diarrhea and constipation, these are important. And the most important of all is bleeding. And any one of these signs, the lump, the sore that doesn't heal, the mole or the wart, the cough or hoarseness, the swallowing, the bowel habits change with bleeding, makes it that much more important. This is the most important sign. So that a lump that bleeds, a sore that doesn't heal that bleeds, a mole that bleeds, a cough that brings up blood in the sputum, swallowing which brings up some blood, change in bowel habits with bleeding from the bowel, all of these very important signs. Now, Mr. Wheatley, I'd like to say that we've pointed out a lot of these things, and I think we mustn't do one important thing. We mustn't scare people with this. This disease I pointed out, we're making progress in this disease. This disease is not as important disease, for instance, as diseases of the heart. And in itself, much can be done. We've shown great progress in the last 10 years. And you must look at cancer as you do at any other disease and not have any special kind of fear, any unusual kind of fear, because cancer can best be handled if it's handled intelligently and quietly and reasonably. Much can be done, really.
And what can the ordinary person do himself now besides watching out for these warning signals? Some other things after those occur.
Well, if they occur, he should go to his doctor immediately and follow his instructions. And he should also, however, not make a neurotic out of himself when he does this. He should go to his doctor and take his instructions and feel that much can be done in most of the kinds of cancer which we have. Older people who have any unusual symptom coming on for the first time ought to see their doctors anyway, regardless whether they fall in this pattern or not.
We're making progress.
We're making lots of progress. Indeed we are.
Thank you, Dr. Rutstein.
The Facts of Medicine has been presented by the Harvard Medical School and the Lowell Institute with Dr. David D. Rutstein, Professor of Preventive Medicine, Harvard University, and Mr. Parker Wheatley, General Manager of WGBH-TV. The Facts of Medicine is made possible by a grant in aid from the John Hancock Mutual Life Insurance Company, directed by Paul Rader and produced by Dr. Rutstein and Mr. Wheatley in the studios of WGBH-TV, Boston.